Hello, my name is Charlotte Walker. Welcome everyone, and I am a registered osteopath and I work in the City of London. I've been working there for over 20 years and I have a specific interest in helping people who are suffering with chronic pain and other symptoms following an accident. And by accident, I mean car accident, motorbike accident, even a nasty fall or push bike fall or an assault, even an assault. And what I'm going to do today is take you through some slides, and I hope to explain what is going on in your nervous system during an accident, which will then lead to the occurrence of these persistent symptoms. And at the end, we'll go over some ways of helping prevent those symptoms from occurring in the first place, and also some ideas as how to go through and treat those symptoms if you're still suffering a few months later. So the title of my talk is Unlocking Trauma Following an Accident to Avoid Pain Becoming Persistent. Now, what I'm going to do to begin with, this is not a very clear diagram, but it gives you an idea of what is going on in the brain. And it's a simplistic view, but I think it's quite useful when talking about trauma. And if you see here, we call this the triune brain. So we divided the brain into three sections. And the green bit looks like a wig, but this is the neocortex. And this is what makes us uniquely human. So this is the area of the brain which controls logic, thought, language, planning, awareness, and such like. Now, the yellow bit in the middle, we call this the limbic system. And this is the area which governs emotions and feelings. And then the deepest part of the brain, the red part here, we call the reptilian brain. Now this is involved in all those automatic functions that your body does when you're asleep or when your neocortex isn't online. So this includes activities such as breathing, swallowing, the rate of your heart beating, your digestion, but also it controls your response to a threat, what your body will do in a threatening situation. And we call these the survival responses. And also, it also controls what happens to your body when you relax. So it's your relaxation response is governed primarily in this area. And we call the survival response and the rest response the autonomic nervous system. That's another way we call it. And this is divided into two sections: the sympathetic, which is the arousal part when you're in a threatening situation, that's what is sparked off, and the parasympathetic part, which is what helps the body relax. Now, when you're in a threatening situation or having in the middle of assault or an accident, your body will really go through quite a predictable sequence of functions in response to that threat. Now, what I've done here is divide it simply into three different parts. And the first is the orienting response. This is the part which is preparing for action. So if you imagine, let's say you are driving along in your car and you hear the sound of screeching brakes, and your muscles might tense a little, and you're scanning the road. This all happens very quickly, but you're scanning to see where that sound is coming from. You're assessing the situation for the threat. This is called the orienting response. You might see that the screeching sound is coming from the opposite side of the road, so that the alarm bells calm down and you drive on, your orienting response. has been complete. However, if you notice, for example, that the car ahead is, the brake lights have gone on, then the threat has been established and your body will prepare itself for action. It will prepare itself to act in the face of this pending threat. Now, there are 3 different ways your body will respond to a threat. And you don't quite know, because this is all automatic, remember, this is all kind of your body acting automatically in that primitive part of the brain. You don't actually know how your body is going to react. And people do very different things. So we call the fight or flight action. So you might, for example, you're driving along, you hear the screech of the brakes, you've assessed that that's a car ahead, you tense your muscles, your heart rate probably increases a little, your vision closes in, and a lot of energy is released into your muscles, so it's like that, lots of tension, and you act. And probably, or some people might slam their foot on the brake, might swear, slam their foot on the brake. That is a fight response. And then you might, slow down and ease your way through. Now, the other thing you might do is flee from that situation. We call that the flight response. So you've assessed that the threat is there, you've seen the brake light, you tense a little, your heart rate increases, your breathing gets a little bit more shallow, and rather than slam your foot on the brake, you grab the steering wheel and you swerve over to the side of the road. You perhaps go onto the hard shoulder, and that would be a flight response. You've escaped, you've fled from the threat. That's a flight response. Now, there's a third response that you might do, and this is called the freeze response. And again, you've assessed the danger, your heart rate's gone up a little bit, you've become a little bit tense, you can imagine driving along. Now, rather than act, you actually freeze. So you're tense, you're grabbing the steering wheel, you're kind of telling your foot wants to go on the brake, but it doesn't. That's called a freeze response, and you go smack straight into the car ahead. Now, it's why you act in these different ways is totally individual, and they don't really know why, but possibly it might be just part of your personality. You're a fighter, you're a screamer, you're a shouter, or it might be perhaps childhood environment, perhaps you were brought up in a family that were real fighters, or that no one showed their emotions, so you tended to freeze the child in the face of threat. So these are the 3 possible actions that your sympathetic nervous system might do in response to a threatening situation. Now, I've got a little video here, and I want you to watch it just for a couple of minutes. And I want you to just have a feel in your body what is going on. So just a couple of minutes. So just have a little look. There we go. Now, so it wasn't very nice. I'm sorry about that. But when I was watching that, I felt a little bit tense. I could feel my heart rate going up a little bit. I was quite alert. Everything else, all the noises in the background faded away. That is an example of a sympathetic threat response, survival response. And if I look at the next slide, here we are. I'll play this for you. Have a look at this. Watch that for hours, couldn't we? That beautiful scene was activating my parasympathetic nervous system. So if you were listening to your body, you probably noticed perhaps a bit of warmth across the chest. You perhaps noticed you took a deep breath. And that is your parasympathetic nervous system coming online. And that is the relaxation response. And in a normal day, a healthy autonomic nervous system will display a lovely natural interplay between these two elements. So here we have a chap being chased by a snake. He's probably got his sympathetic nervous system and his fight or flight response highly activated here. And again, that's the sympathetic activity, lots of charge in the system, lots of energy mobilized into his muscles. He's probably running very fast or grabbing a stick to try and beat the snake, all those kind of things, heart rate high, is what we've talked about. When that threat has passed, then your parasympathetic nervous system will start kicking in. This is what governs the rest, and your heart rate will slow, and your breath will probably slow, your heart rate goes down, and you'll come into a nice state of relaxation. And during the day, you'll find just a lovely natural interplay between these two elements of the autonomic nervous system. The fight or flight, which is the sympathetic, which is the threat response, and then the rest, digest function of the parasympathetic nervous system. Now, the problem arises, we talked about those threat responses. You've got the orienting response, the fight or flight response, or the freeze response. Now, problems arise and symptoms can drag on and on and on when those survival responses are interrupted and they're unable to complete, so that the parasympathetic nervous system hasn't been given a chance to act and to relax the system down. So what happens is that the nervous system gets stuck in survival mode. It gets stuck on. So even after the accident has, it's been weeks behind, or the threat has passed, the assailant is long gone, the nervous system is still acting as though the threat is present. So it's stuck on. And all the survival energies that were released to counter that threat, to, in the car, all those energies that mobilized into braking and trying to steer your way out of danger, all those energies mobilized into the muscles, just get locked in the body, and they're haven't been given the chance to discharge. And that's when those long-term trauma symptoms, including pain, muscle tension and pain, and they continue months into the future. Now, basically, this happens. The problem with accidents and these big events, that the stimulation to the nervous system is huge, and the person's capacity to cope with that stimulation has been overwhelmed. And what we say in this field is that the experience is too much. So it's too much stimulation, it's too fast, and it's too soon. There's no time for that nervous system to respond in a healthy way to that experience. It's too much, too fast, and too soon. And I just wanted to show you this, which is a car accident, but I just want to give you an idea of how fast these accidents can occur. The timing is so split second. So you can see how your nervous system basically hasn't got a chance. And if I show you, I've got to
was shabby.
just move along, can't see the.
Also, another cabinet.
Hold on, I go back. Sorry about this. Here we are. I'll just get there, because this is, I'll just get, oh, there, here we are. Let's just go again. Technology, not very good at it, so we'll try this again. There we are. Let's play that. There we are.
Are you okay? No.
Yeah. You can hear that there's a fight response in the background there. You hear the guys swearing, but can you see that that was unbelievably fast? And there's absolutely no chance for the nervous system to respond in a healthy way in that scenario. And I don't know these victims, but I can bet you that they were suffering from for some time afterwards. So that was just a nice illustration of how fast these car accidents can occur. Terrifying. Now, I want to tell you a story about Stan and Uta. They're two Canadians, and husband and wife, and they were travelling just to work one morning on the Highway 401, just outside Windsor in Ontario, Canada. Now, they hit a wall of fog, a complete wall. It's notorious, this stretch along on this highway. And before they knew it, they'd smashed into a van in front of them, and then split seconds later, 3 vehicles behind them piled up behind them. Their car was jammed it was swung around into a sideways position, and they were trapped. And you can see, this was September the 3rd, 1999, and you can see this was the biggest pile-up basically in Canadian history, probably all over North America actually. Look, this is later on in the day. Absolute devastation and carnage. There are 97 vehicles involved, many fatalities, and many injuries. And Stan and Uta were used in a study following this incident. And what happened was that their brains were scanned several months later. This is the following April. It's American Journal of Psychiatry. And they were scanned using functional MRI scans as a way of looking at the activity in the brain. And this is Stan's brain when he was asked to recall the scene of the accident. Now, when he talks about the accident, he remembers being highly stressed. He took his safety belt off. He was swearing. He was screaming. He was trying to open the car. He was log jammed into the vehicle. Couldn't get out. There was smoke. There was flames outside. There was a young girl on the roof of his car that was banging, shouting, "Help me, help me!" And then the most horrific thing happened. They saw this girl burst into flames and burn in front of them. And anyway, when Stan was recalling this horrendous incident, this is what his brain showed. And you can see this is a brain displaying a fight response. You can see it's all action stations. You can see all areas are being activated. You can see even the limbic system in the middle there. There's a lot of emotion going on too. So this is a highly activated, stressed brain. And this is months afterwards. Now, his wife, Uta, who was sitting in the passenger seat, so was witness to exactly the same crash, saw the young girl as well. She describes that incident as for a start, she doesn't remember a lot of it. There are fragments of memory, so it's not so clear for her. She remembers obviously feeling very shocked, feeling quite numb, and she couldn't move. And if we look at her brain scan, her functional MRI scan, we can see how empty it is. Look, nothing going on. A tiny bit back here, probably, that looks like a bit, perhaps the visual part. So this is, I love this, it's beautiful, beautiful scan. This shows a freeze response. The brain has just shut down, nothing going on. And that was her body's, her nervous system's attempt to survive that awful, horrific incident. This was what her body did. The body decided just to shut it down. And Stan's, his response was to fight, to get active, to mobilize things, to get out of the car, to smash his way through. And I'm glad to say they both survived, but they both struggled with post-traumatic stress disorder symptoms, including tension and pain months afterwards. And actually, interestingly, they didn't actually suffer any particular physical injury. It was just tension and pain from literally the amount of energy, survival energy, that had been released into those tissues at the scene of the accident. So I love that study, that's fascinating. So to go back then, just to repeat, if during an accident, your nervous system will activate its survival responses. That's the sympathetic nervous system. You have a fight response, a flight response, or a freeze response. And if the fight response, like Stan, is interrupted or incomplete, months later, these are the symptoms that you might be experiencing. You might be feeling pain in the muscles and tension. You might feel kind of easily triggered, quick to anger, that kind of, so there's a lot of, remember that you're still stuck in that survival mode, so there's a lot of activation going, a lot of agitation all the time. These kind of people might struggle with panic, there's a lot of anger, and often flashbacks, difficulty sleeping and such like. And this is one of the key things. A lot of these symptoms aren't generally brought up. We talk a lot about pain and muscle tension, but a lot of these other symptoms are also around, which people often don't just kind of get on with, don't realise are part of the post-accident symptomatic picture. And if you can imagine your body constantly in that space of threat and survival, that is an exhausting place to be. And this is one of the key symptoms for actually all these problems is exhaustion. And if we look at Uta, our lovely lady who displayed the freeze response, so months later, she was still feeling a lot of muscle tension, no pain, interestingly, but you have this kind of numbness. You almost kind of, you saw her brain, it was completely empty. There's a kind of a cut-off, a kind of dissociation. You're not all quite there. And you can feel forgetful. You can find work quite difficult. You can feel it's difficult to concentrate. You kind of dragging yourself through the day, somehow feeling a little bit unable to make decisions, just move forwards, and just generally low, kind of depressed. And again, just feeling exhausted all the time. So this is a freeze response that hasn't been allowed to complete, and these are the symptoms that you might be experiencing several months on. Now, the other survival response I talked about was the flight response. That's when you're fleeing from a situation. And again, slightly different symptoms. Obviously, these all overlap, but I've just done this just for ease, really, during this talk to divide them. And this is an interrupted flight response, and I can think of a chap a firefighter. Let's call him Steve. and he was called to the scene of an accident, and there'd been a collision. So the car had crashed, quite severe, quite a big collision. And firefighters are trained to turn off the ignition of all the vehicles. That's the first thing they're trained to do, and that's to avoid to avoid explosions or fires. That's the first thing. So he opened the driver's door and put his arm across the driver to the ignition to turn the key, to turn the car off. Now, just at that moment, he looked across at the passenger seat, and there was a horror. Basically, a young girl had been decapitated by an airbag, which airbags can cause a lot of injuries and broken arms and things, and this was particularly horrendous and awful. Now, seeing that, dear Steve, of course, a survival response was activated. It was a horrendous situation, and all his body wanted to do was to run, just to flee. So he'd had his arm in the ignition, and there was a strong urge to take his arm away and just run from the scene. So all that energy to move his arm was mobilized in his muscles. So it's all got tense and mobilized. But interestingly, he didn't move his arm. He didn't respond to that urge, because he knew as a firefighter that the first thing he had to do was to turn the ignition off. So he did the right thing. He turned the ignition off. But the problem was that he'd thwarted that instinct to move his arm away. So several months later, unsurprisingly, he was still experiencing a lot of pain and tension in that shoulder. Actually, I think in the end it turned into a frozen shoulder, which is a particular condition. So you can imagine the amount of energy that was mobilized, stuck in those muscles, created all sorts of problems months later. That's just an example of an interrupted flight response. And typically we have, again, pain and muscle tension months later. Get anxiety, a little bit of that kind of twitchiness, obviously wanting to avoid situations, finding it quite difficult in stressful situations to cope, you wanting to move away, to do other things. And of course, again, here we have exhaustion appears again, because that your body is still in an activated stuck on position, and that constantly running that in your body is exhausting. So that was Steve. And the last response, do you remember, was I talked about the kind of preparatory response, the response which is assessing the threat, the danger threat, it's what you're doing when you hear sounds, you're trying to assess where that danger is coming from. We call that the orienting response. And that can be interrupted as well. And that can cause other types of symptoms. And I can describe a patient of mine, let's call him Simon, who was walking along a pedestrian area and heard some brake beeps. Vans have those kind of braking sounds. Those are those beeps. So he immediately, kind of where's that coming from? That's strange. It's a pedestrian area, I'm looking around. And before he really had time to assess that situation, he'd been hit. The van had reversed into the back of him. He didn't see it coming, so it's a total, it came so quickly, and he was flung into the air landed on his knees actually, and then his face had some horrendous injuries to his face and jaw. And several months later, unsurprisingly, he was still suffering from a lot of pain and muscle tension in his back, actually in his neck. And he was finding, he was very easily startled, he was jumpy, tense, he was finding it very difficult to cope really in stressful situations. He found it very difficult. His capacity to deal with stress had really quite reduced quite significantly. And he describes it just a little bit more anxious, a bit more jumpy and tense. And not in his particular instance, but classically, if you've had a threat come from behind, somewhere that you haven't, from different that you're not aware of, often you can feel a bit jumpy and a bit nervous when perhaps someone might come behind you, walk behind you. That's when your nervous system will be a little bit agitated, and that can continue for quite some time afterwards. And of course, here we have it again, the exhaustion. So he was really struggling with just feeling tired and exhausted in his day-to-day. So that is an interrupted orienting response. Now, so you're probably asking yourself the question, well, what can be done to avoid that the nervous system, the sympathetic nerve, becoming stuck on that on position? And there are actually lots of things you can do, especially if you're a witness to the scene of an accident. And if I go, here we are. We're back in Ontario. These are some photographs of the pileup I talked about earlier with Stan and Uta. And the problem in accidents is that there's lots of people around. There's often police there. They're often asking you questions. There's a lot of noise. There's fire. There's smoke. There's screaming. They can be very stressful situations, and they're not conducive to relaxing for that. Don't allow a parasympathetic nervous system to rise up and counter those threat responses that have been activated. So if you can, if you're able, if you're a witness in these kind of situations, it's just taking your time, taking a victim to the side of the road, just a bit of touch, holding hands, just some gentle words, perhaps a rug around the shoulders, just to give the victims time, just for their nervous systems to calm down. And this can be really, really helpful. And often, as I said, when there's a lot of commotion, and often if you're a victim yourself and you've perhaps got other passengers or children that have been involved too, often you put your own needs to one side and you're hurrying around trying to help others, and that's again you're not enabling your own nervous system to do its natural thing of calming down. So at the scene of the accident, you can do a lot to help prevent persistent symptoms from carrying on. Now, you're in the ambulance. You've arrived at the A&E department. Again, bright lights. You've got consultants charging around. They are not relaxing environments. And again, this is your nervous system is highly charged. It's highly activated. This is not an environment where you can easily relax. Beeping monitors. There can be, here we have hurrying nurses. It can be quite, it could be a horrible, horrible place to be. So again, if you're someone that's with a victim, that's been together with them, it's just making sure they've had enough time and space to calm. And this is, we have a lovely nurse here just giving that lady some kind words, perhaps some encouragement. You're here, you survived. it's going to be okay. You know, you're in good hands here. Just as this is exactly where you want to be. It's going to be fine. And just allowing time, allowing space for those nervous systems just to calm down. And that's very, very key. And with children particularly, who get obviously very frightened as well, it's really important to really help them deal with their emotions, allow those emotions to come up. And actually, I didn't mention this, but if we go back to the scene of an accident, it's not uncommon after an assault or a really overwhelming threat like this, when your nervous system is discharging, you can tremble and you can shake a lot. You can, you can be like this, and that is totally normal and should be encouraged, should be allowed. And that is that energy, that survival energy, that is that energy releasing out of the body tissues. And that is a really important natural response to coming out of a threat. So that really should be allowed to happen. And emotions as well. There are lots of emotions. They should be allowed to come up, and tears or anger even, just should all be allowed to be felt. So there we have the hospital I've talked about, and also if we go back to my little list here, if obviously months afterwards you're struggling still with symptoms, obviously there's SIRPA, Georgie's lovely chronic pain list of practitioners that you'll have access to. It's very important to try and see someone that's specifically trained to help with these kind of problems. There are lots of trauma therapies out there. I use something called somatic experiencing, SE AUK is our organisation, which is a body-based trauma therapy, which was started in America actually with post-Vietnam War veterans by a chap called Peter Levine, and he's developed a gentle body-based therapy which allows your patients in a session just very gently to release those survival energies in a controlled and gentle way, not in a you don't necessarily have to recall as well. You don't have to necessarily go back to the scene of the accident. So you're not having to necessarily relive the trauma that you've experienced. So it doesn't necessarily have to reactivate all those stresses. So that's a very nice way of helping if you're struggling with these persistent symptoms. Now, the last thing I wanted to talk about was physical therapy. Now, I'm an osteopath, so this is something I know a lot about. And if you've had an accident or trauma and you're struggling with pain and tension following on from that, for example, if you had a whiplash, which is a neck injury during a car accident, is when the neck is thrown violently forward and then violently back, and you can get a lot of pain and tension in the body tissues. If you have a physical therapy which involves quite a lot of deep tissue massage, for example, or sometimes some therapies involve quite high speed thrust, get the high velocity thrusting techniques, the chiropractic techniques, that is very activating for a nervous system, those kind of therapies. So they actually often are not helpful. And what they can do is, just when your body's trying to relax months after an accident, they can actually reactivate the sympathetic nervous system, actually create quite some problems and create quite nasty treatment reactions. So if you want some physical therapy to calm everything down, just make sure you choose one which involves very light soothing touch, which is speaking and encouraging your parasympathetic nervous system to come online and reduce the activation of your sympathetic nervous system. So cranial sacral therapy is very good, or just gentle, very gentle massage. But just make sure the practitioner that you have you're using is aware of the traumatic beginnings of your pain, so they can be sensitive to that. So if you found yourself a victim of an accident and still struggling with symptoms, there are things you can do yourself at home to help reduce those from continuing. You can try just practicing some just gentle self-soothing, some rubbing of the arms, just to help, again, bring the parasympathetic nervous system online, help reduce your heart rate. You can try some deep belly breathing. There's lots of apps you can download on your phone to really help again control your breathing, help everything relax. You can watch a nice video of a palm tree on a beach for 3 hours. That can help. And also you can, if there are a lot of emotions still might be present, following an accident, it can be quite traumatizing, emotion. There can be a lot of fear. There can be, so addressing those just through some emotional awareness techniques that we use at SIRPA, that can be very useful as well. And I think just giving yourself time and space just for your nervous system to calm. And that might be trying to reduce the external stresses that might be at play in your life at that time. Perhaps reduce your workload a bit, make sure you're sleeping properly, reduce your caffeine intake. That's the classic one that makes your adrenaline start running. So there are lots of things that you can do at home to help bring your nervous system down into a more restful and more relaxed state. Good.
Great. Thank you very much, Charlotte.
Great. Thank you, Georgie.
We'll make sure that you're around and we're around just to keep an eye on any Q&A.
Lovely. Okay. Thank you for listening.
Charlotte.
Bye now.